Greetings from Citizen Health and the Team Academy IAPS and MeConnect. And today, in the series of People's Health It Matters, we have Dr. Uday Shankar Singh, who is a professor in Pramukhswami Medical College, Karamsat, Gujrat. A very warm welcome to you, sir, on behalf of all the audience.
Thank you very much, madam.
Today, we are going to talk on a very interesting topic, that is palliative care. We must have heard about the palliative care, but we may not be very much aware about it. So, we will today know about the palliative care, what is it, and how to do, is it necessary or not. So, should we start the session, sir?
Yeah, definitely.
I would like to start the session with my first question, that what is palliative care and is it a new concept for our country, and what is the hospice actually?
Okay. Uh, Actually, first of all, I'm really thankful to our IAPSM for such a wonderful initiative where people can contribute something and which is not well known to everyone in our country. Uh, about palliative care, actually, I'm working in community medicine, and last 4 to 5 years, actually, I'm closely associated with palliative care. Though I have not worked much, but I have received a few training in Gujrat Cancer Research Institute in Ahmedabad. That was actually under the banner of Indian Association for Palliative Care. The Type A and Type B certificate I have received. That was hands-on training was given by them. And afterward, actually, I came very close to this concept. And since then, I was thinking uh, we people from community medicine can definitely do something for something in palliative care. So, because you have asked this question, what is palliative care? There are various definitions, but WHO defined palliative care as a total active care for the patient whose disease is not responsive to any treatment or cure. So in that case, we should provide. I mean, where the cure is not seen, and we are unable to provide good, I mean, curative therapy to that patient, then palliative care starts. And you said, is it a new concept? This is a popular word nowadays, but the concept is not new. Why? Uh, because if you see our ancient India and ancient world, care of dying person has been regarded very high. Those who are dying, and because of various reasons, maybe this has been regarded in India. Actually, those who are providing services to such people are actually linked with punya karma, and this word hospice. Your third part was what is hospice, and this hospice concept was even not new. If you enter in history, you'd be surprised to know our King Asoka in India, 230 to 273 BC. He made around 18 such institutions in India, which are actually very much similar to hospice. And one such center is there in UP, Varanasi, near our river Ganga, sacred Ganga. And the concept is very similar. Those actually at the stage of time, they should be given due regard and should be taken care of. And and about palliative care, I would say initially palliative care was regarded as along with the treatment of cancer. But this is not just related with the cancer. When WHO says like a palliative care is an approach to improve quality of life of individual, where everyone can enter inside. And quality of life, if you see the quality of life, we all are actually, we all people, all professional are working for quality improvement in quality of life. So, and in modern hospice, I would say modern hospice, hospice is something related with one lady, Dame Cicely Saunders in UK. uh, C has actually made the word very familiar. And in India, the first hospice was established, if I'm not wrong, in uh, Mumbai. Mumbai, that was known as mm, Arogya, is something somewhere in Mumbai that in India, Santi Avedana Shadan. Santi Avedana Sadan uh, in Mumbai. It was regarded as the first hospice as per literature says. So this is about palliative care. And everything, as I said, the concept is not new. It's very well known to our people. Yeah,
Sir, do we really need palliative care in our healthcare setup?
I think yes. Averagely, in India, if you see literature, in India, around uh, 9 million people are dying per year. So many people will be surprised. 1 करोड़ लोग लगभग ऐसे भी डेथ होता है अपनी कंट्री में बिकॉज वी हैव ए लार्ज पॉपुलेशन बेस इन आवर कंट्री. Or disease transmission, if you see, initially there were more number of non-communicable disease problems seen in our country. Now non-communicable disease problem is more and more. And because of this, actually, I would estimate around not less than 34 million people are in need of palliative care services in our country, but access is less than 1%, as it is there in literature. So very less number of people are actually in access of palliative care. In 1984, Government of India has given one directive that pain to be associated with relief of pain and pain management to be associated with the integrated with the primary health care, but it was not translated well. And what I believe only in Kerala state, there is a good concept of palliative care, and palliative care is provided through primary healthcare approach, but not in any other state of our country. I mean, in integration in primary care, what I mean to say. Though palliative care exists everywhere,
Right.
so in my opinion, yes, we need.
So is this palliative care? I can understand that with your words, I can understand that this
Hmm.
palliative care is different with curative care. But can you please explain, sir, that how this palliative care is different with the curative care?
Goal of palliative care, the goal of curative care is to provide complete cure, and that is not the case every time. You cannot cure. You cannot cure all the diseases. There are many diseases, many chronic diseases, including cancer and many non-communicable diseases, where you cannot provide complete cure. But you'd like to help a person in terms of you'd like to person is suffering, but you like to promote his health. You would like to prevent his illnesses. If he's suffering with pain, you like to provide some sort of therapy where the pain could be minimized or pain could be mitigated well. You'd like to restore his functional capacity. Whatever functional capacity person may be having, we like to restore, and that what the palliative care exists. For that purposes, palliative care exists. Yes.
So is that a different kind of palliative care? Like what are the different kinds of types of palliative care?
As per the literature, na, there are three types mentioned in literature. First is primary palliative care. Primary palliative care. Primary palliative care uh, is a kind of care like primary health care, where a health professional, a nurse, or even any the paramedic, they can be trained well, and they can provide palliative care services to the community, and that is the first level of contact. Because in palliative care, you would actually know that many people are not having access to the health center even. So primary care is a actually base care, and which is to be provided like the primary health care, similar to primary health care. That is the primary palliative care. The second type of care is a specialist palliative care, or a specialty palliative care, we can say. The specialty palliative care services are provided in a tertiary care setup, where they are getting some referred patient, and as a kind of interdisciplinary approach. Patient is admitted in, maybe if I'm taking one example of like cancer, oral cancer. Patient is admitted, he has been treated, and patient has referred to palliative care setup. uh, because in palliative care setup, a patient actually, why he has been referred, because the patient was not unable to digest, unable to consume anything, any food. So in that case, what happened? The palliative care person, they actually help to enter Rile's tube in that person, that patient, and at the same time, their family, relative, and everyone are actually educated well enough so that this good care could be provided at his home even. So this is the actually different. So this is the specialty palliative care. And the third part, or specialist palliative care, we can say. The third part is a pediatric palliative care. Pediatric palliative care itself is a separate branch, where those children who are having, I mean, different kind of complex kind of abnormality, uh, their body, mind, soul, and everything is treated, and they are and their family is well supported. One such instance was given in one of the presentation by Dr. Rajagopal in our setup. There was one child who was suffering with such kind of terminal illness and crying constantly, day and night, and his sleep time maybe around 9 to 10 minutes was there. And in that case, what happens? Their family was in such a stage. Family has reached to that stage where their parents were actually ready for divorce, and somebody has suggested, please visit to some palliative care person, he will help you. And then the person, that child was treated, and afterward the everything, because you can imagine, there is a child and creating problem for everyone, and nobody is actually able to work peacefully in the house. So pediatric palliative care itself is a separate method in different, in three types of palliative care: the primary palliative care, then specialist palliative care or specialty palliative care, and pediatric palliative care. These three types are there.
Sir, are these care is a pocket friendly or a costly?
No, most of the actually palliative care facility, pocket friendly and costly. If it is being provided in tertiary care setup, definitely it would be costly. But if it is the community palliative care services are providing, suppose somebody is in need of palliative care services, and palliative care, in palliative care OPD, the family and relative all have been educated well to provide support. So his services are almost kind of, the only this thing, material cost would be there. And at the same time, palliative care actually involved with the communication skill. Very good communication and counseling skill is part of palliative care, and it supports very well to the family and the person as such. And in terms of model, I would say what where I am more interested, the last part. Uh, Actually, there are many models of palliative care practice. The first is a kind of hospital palliative care services, where I have been trained in GCRI. That's a kind of hospital palliative care model, consultative level. In consultation level palliative care, now it is very popular, and many institutions are having, they are offering MD palliative care. Even in GCRI Ahmedabad, they are having MD palliative care degree is available. Uh, so that is a kind of hospital palliative care. In hospital palliative care, two parts are there. One, the consultative. Consultative means different discipline people are there. Across the discipline, people are there in that center. Maybe anesthetist, surgeon, and some people are there. So they are dealing with a complex kind of situation. Uh, Complex kind of situation. In one of the good example is there in Ahmedabad. They have developed one hospice. That hospice is associated with GCRI, and people from GCRI, they are actually managing this hospice. And what is happening if suppose a patient, they're in the terminal stage of cancer and suffering with a breast cancer and develop maggot in the means her ulcer becomes very very stinky, very difficult to manage, and they are admitted in this setup. And these people are day and night, they are given care, and after some time they are leading, I mean, they are not going to get the cure, but after some time they would have a very comfortable life. It is really very difficult to recognize a person one day before. If I have seen a person in a lot of pain, the next day the person is very cheerful and sitting and discussing some other issues with their family and friends. So it's a kind of miracle what I believe, because it's a completely having all kinds of component. So one is a hospital-based palliative care model. The another where I'm more interested, but still I have not started much work there. That is a community-based or home-based palliative care. I'm more interested in that. And in home-based palliative care, I would like to say that we people from community medicine definitely do much more things there, because every community medicine department is associated with one rural health training center and one urban health training center, and they have good number of functionaries working in home-based palliative care or community-based palliative care. What I'm trying to tell you, all functionary, including our medical officer and all other medical social worker and all other health functionary, they can be given some sort of training about palliative care, and they can identify people who are in need of such services. And because identification, once you are going to identify, then and then you would be able to provide such services. And such people are there in community. Only thing, you have to visit them and you have to identify them and you have to convince, and at the doorstep you can provide the services. So many good examples are there. Is not only I'm talking about terminal stage of cancer, but I'm talking about any non-communicable, because most of the non-communicable disease at the at their last level, it's incurable, and they need some sort of services of palliative care. So actually I'm trying to establish one such model in my setup. There are difficulties, but definitely we would like to do some more justice to such care. Yes.
That sounds very great, sir. That sounds very great, and all the best for that also. And thank you so much for spending time and sharing your wisdom with us. We are very happy to know today that the palliative care is not a word only; it is a help. It is a greet for a person who is going to die anyhow because there is no cure. If I'm not wrong, sir, is that so right?
True, true. Now, I would like to share one of the experience there. Many a time, what is happening? The person is going to die, but his family member are insisting, the treating person or even the palliative care, sir, please do not share this information with the patient, because patient is, that is known as collusion. The word is collusion. Please do not share any information. He would broke down. You know, principle says, if we were involving a person in the treatment would be much better. And many patients are having some kind of desire that before dying, they want to go somewhere. Before dying, they want to pray. They want to visit some family members. So actually, such desire, such kind of communication, through such communication, palliative care professionals, they can come out with some solution and help the person who is actually about to die. So that's the greatest part of palliative care, what I have seen in my observation in last 3-4 years.
Great, sir. You all are doing such a great work. I'm really saluting you all for this. And thank you so much for having talked with us today, sir. I just hope that we can do more and more session for any other topic. Thank you so much, sir, for the session today.
Thank you very much, Ritu. Thank you very much.